this was just a huge relief to realize that there was, in fact, an alternative to what I had been offered in Canada. I was told there that these kinds of surgeries can be done in Canada, but it takes about 2 years before you can get a diagnosis and another year before you could get surgery. So for a person who is 87 years old, to wait 3 years for an operation that can be done as quickly and cleanly as it's been done here was totally absurd. That was simply a death sentence.
We know that living with pain every day is not truly living. At NSP Clinic, we created our medical tourism program so that patients from anywhere in the world can access to high specialty procedures when they need them without waiting, because time matters and so does quality.
It will extend my lifespan, because if I had been waiting for all that time doing nothing, getting more and more degraded, that's going to shorten your life. What has it been, about 8 or 9 months that we've been in this process, but I expect to be back to normal walking probably within the next 6 weeks, and getting back in exercise. I was previously active in golfing and walking, usually up to 5 miles a day, and I'm now confident that I will get back to that level very promptly.
Over the years, we've been refining our medical tourism program with one goal in mind: to make sure no patient feels alone ever in this process. Hi, I'm Dr. Raul Rincón Navarro, neurosurgeon, spine surgeon, and medical founder director of the Neuro Spine Pain Clinic, Los Cabos. From the very first call to the day you go back home, we're here for you all the way. The process starts from home. You book a virtual consultation with me. No traveling is needed at that moment. I review your case, all the imaging, and together we define the best way to go forward. When you arrive to Los Cabos, everything is already planned and scheduled. In some cases, we understand that it's hard for you to get some imaging at home, so we schedule all that here in our facilities, and we guide you through every preparative step. The surgery takes place in the hospital right next to the clinic, and the hotel is right literally steps away. Everything happens in one place, so you don't have to worry about logistics. And when it's done, we don't just send you back home. We stay with you through all the recovery process, because the surgery is only one part of getting your life back.
I'm Richard Robertson. We live in Comox, British Columbia in Canada, and I have come here for minimally invasive spinal surgery to relieve back pain and limping problem with my legs. The operation was carried out very promptly and in very orderly fashion. I'm now in the recovery phase, which will go on for a few weeks. It's been very quick, direct, without any problems at all. There are a few things that have a few delays. You have to fit into the schedules the hospital has, and we were given a choice of 2 possible surgical dates, one of which came so quickly that we couldn't quite accommodate it, so we came for the second one and have now completed it. It was really excellent. We had a video conference with him that was arranged by Canela Health Services, who placed the call and set it all up. And as soon as he got Dr. Rincón on the screen, he just bowed out, and we carried on the conversation with Dr. Rincón. He had the MRI on a big screen and went through with his pointer and identified exactly where the compression of the nerve was taking place. What was a great surprise to me was able to identify the fact that I had had a recent event that aggravated my back. He could see that there was something there that had happened recently. Also that my back was making an attempt to repair itself. He could identify the new growth, and the detail of that was very impressive. It gave us a very high level of confidence in his analysis, his diagnosis. He went on to describe in great detail how this minimally invasive surgery would take place, that there is a very small incision and then the instrument inserted into the spinal column, rather than cutting anything, simply squeezes them apart so that he can access the area that needs to be decompressed without having to sever any tissue or bone. And of course, the whole thing comes out as nothing but a bruise, really, rather than an incision. It avoids actually cutting parts of the spinal column away. And because of that, everything has been pushed and squeezed and bruised a little bit. It's going to take a few weeks to recover, but by comparison with the kind of surgery that we had been hearing about previously, which would have required fusing two of the vertebrae and putting metal props in there, would have been a 6-month recovery period. Why, with this procedure, we're talking about maybe 6 weeks at most. That was one of the very encouraging things about realizing that this was an alternative that was available to us, and just a great relief knowing that this could be, not only that this could be done in this minimally invasive fashion, but also that it could be done within a really reasonable time frame. The alternative within the Canadian healthcare system would have had me in a relatively idle situation for up to 3 years before being able to have any kind of surgery. And since I had already been told that at my age it wasn't really recommended at all, the alternatives I was being offered there was just a long, slow decline followed by medical assistance in dying. So having this alternative available to us was just a wonderful relief, and really gave us a new lease on life. Yes, and so that was how that was the meeting, and Dr. Rincón could have done it almost right away, but it just didn't fit with our time schedule. So, but it was what about 2 weeks until we could come down here and have it done. So then we had a 1-day flight down here into the hospital the next day for a very thorough pre-op series of blood samples and various test work scrutinized to make sure that my brain was okay with it as well, and they decided that yes, you're in good shape. And the following day we had the surgery completed within I think about a 6-hour period, and from the recovery room, once all the main tubes and everything could be removed, we were moved into a really beautiful little suite, a very comfortable bed. And Marilyn had a little couch that made down into a bed so that she could stay overnight with me. And the treatment there was just wonderful. It was all quick and thorough, and gave me a great feeling of confidence in how we were being handled there. And I followed it up with a good solid 8-hour sleep and woke up feeling just great. I vigorously recommend it to anybody else who has this problem.